Hello and welcome. Thank you so much for joining us. I'm here with Dr. Gary Goodman, and I'm Dr. Christina Gowan from the University of Arizona Cancer Center. I'm an assistant professor of medicine with a focus on malignant hematology and, fantastically, and our topic today, integrative oncology. I'm also the co-director of the first training program in integrative oncology, the Integrative Medicine and Hematology Oncology Fellowship Training Program. And again, I'm joined by my guest, Gary Goodman, Dr. Gary Goodman, who has a fantastic wealth of knowledge that he's bringing to the table, literally the table today. And so I'll tell you a little bit about his background. He trained at the University of California in Los Angeles, and that was for his undergrad, and then did medical school training in Wisconsin at the Medical College of Wisconsin. He completed a surgical urology residency in New Mexico, so going back to the warm weather from Wisconsin. And then we were very lucky that from urology, he developed an interest in integrative medicine and went to the Andrew Weil Center of Integrative Medicine fellowship training program, which he completed in 2017, and then followed that up with board certification. And he brought all that fantastic knowledge to the University of Colorado Health System, where he directed the integrative medicine program there for cancer patients. So thank you so much, Dr. Goodman, for joining us. I'm very excited to have you here and to learn from you and hear all your fantastic experience.
Generally deal with in integrative medicine, those being nutrition, exercise, stress reduction, toxin reduction, sleep, social connection, spirituality, and supplements, including possibly cannabis. We have a mock typical patient. She has recently been diagnosed with early stage breast cancer and hasn't quite decided on therapy. She's in our healthcare system, so we don't have to have her fill out past medical history, family history. All of that is already in the chart. We're just going to be looking at the integrative medicine questions. She's filled out those questions. We're going to go through them, and before seeing her answer, we'll review notes and tools that can be used covering the subject of the question. How the consultation proceeds really depends on the patient's answers, and we prioritize the patient's integrative medicine needs based on those answers. Once the patient completes the form, my medical assistant would retrieve it and input the answers into the EMR. We then call the patient back, welcome the patient, serve some green tea with matcha, and use that opportunity as an example of how we obtain beneficial plant compounds from nature that help with cancer treatment, we try to move away from the focus on supplements that so many patients are looking at and try to talk more about getting these beneficial compounds from nature. In this introductory time while sipping our tea, I may show a handout on the biochemistry of phytochemicals, which includes EGCG, epigallocatechin gallate. I also may show the epigenetics illustration to illustrate the reasoning behind changing behavior, empowering the patient to optimize as much as they can epigenetic outcomes. The form begins with a disclaimer and a reminder. The treatment the patients receive in this integrative medicine clinic is adjunctive and does not replace conventional care. The patient will continue to be under the care of their primary physician. And then I have their primary family doctor and their primary oncologist. In your cases, you may also be the primary oncologist, and that's fine. Coding in that case would be the same. In either case, using the new patient code is based on time. Then I have an accepted definition of integrative oncology. The rational, evidence-based combination of conventional therapy with complementary interventions into an individualized therapeutic regimen that addresses the whole person living with and beyond cancer, body, mind, and spirit. So the first question we get to is, are you taking any herbs and supplements? If yes, please list dosage and frequency. Now, here we have a tremendous opportunity. Many patients, this is really what they come in about. It's not so much we want them to be on supplements, but they tend to do that. There are studies that show cancer patients are doing a lot of complementary and alternative therapies, and a lot of them are taking supplements. So here's an opportunity to find out which supplements they might be taking that are harmful. For example, St. John's wort induces CYP3A4, ginkgo and CBD inhibit CYP3A4, and that's an important enzyme in the metabolism of many therapies. So it's really important that we get to know what they're on and that they're honest about what they're on. Now,
that's the key, right? Is honest, right? We
honest
have to ask.
is huge.
We
Yeah.
have to ask them these questions because, they often aren't telling us, right? I actually did a study looking at that, and up to 60 to 80% of that study participant, we had 800 participants, were not disclosing their supplement use.
And how about the ones that go on the side, they get mistletoe extract injected into their subcutaneous tissues, and they don't tell us?
Right. Right. So, transparency is key, and to invite transparency, we have to be asking those questions.
Right, right. So here we also can empower the patient. There's the Memorial Sloan Kettering Cancer Center has a Search About Herbs website that is available to everyone on the internet, and that's easy to use. And, for example, I just mentioned ginkgo. That can be looked up there. If the patients have specific questions, we have access to Natural Medicine's comprehensive database, which really helps to go through side effects. ConsumerLab.com is less useful compared with Natural Medicine's comprehensive database, but that's another good one. Sometimes patients will come in and ask about, well, I heard this supplement will cure my cancer. Are there any clinical trials, or can you tell me more about that? And then I tell them about clinicaltrials.gov, and they could look up those trials that have been completed, et cetera, et cetera. Then there's the NCI database, PDQ, under complementary. That has a lot of very interesting ones. Medicinal mushrooms is there, mistletoe is there, et cetera, et cetera.
Yeah, I would say that the natural medicines database as practitioners for me has been the most informative because as an oncologist, it's first do no harm, right? And so we really need to be looking at the chemotherapy and then what are the supplements that they're utilizing and being sure that if they're not already PubMed indexed, actual research projects looking at those interactions, looking at the potential for interaction. What are the mechanisms? What is the actual pharmacology that particular medication is going through? And so I love Natural Medicines database. I use it every week. And so I would encourage all fellows interested in integrative oncology to definitely be utilizing the Natural Medicines database and indexing chemotherapy interactions.
I agree that many a clinic visit has spent much time on Natural Medicines Comprehensive Database, going through, letting the patient know why it's okay for them to take this one, why this might not be such a great idea, and why this is definitely a very bad idea.
Right.
Next question on the intake form, goals. Please list the reasons you have come to this integrative medicine clinic. Now, this question can really stand alone as the only question on an intake form.
Mm-hmm.
And there are some practitioners, that's all they put.
Yeah.
And they enjoy the flow and the elaboration that comes from that. From the patient's goal, the discussion can be directed to the integrative areas previously mentioned. This patient's answer: healthy eating, exercise, and if she should take any supplements that she's not taking. At this point, I generally start taking down notes for myself as to where the consultation is going to go once we're done going through the intake form.
I'd say you lucked out with that patient because you already have them interested in healthy eating and exercise, and that's not always the case. So we're starting with a leg up on this one.
Yeah. The next question, what is your chief concern? Can you tell me the history of that? And at first glance, this may seem redundant. It's surprising how different the answer here is compared with goals.
You bet. Well, and I think that's particularly true in our chemotherapy patients, right? Because they may have goals, but some of their concerns often are really related to side effects and toxicities. So I think it is important to tease those two apart.
Right.
Yeah.
In this patient's case, she answered fatigue and buying healthy food.
Mm-hmm.
Next question, how do you perceive this condition? How does it affect your life? Yet another way to allow the patient to communicate what is on their mind. For me, these prior 3 questions help in getting to know, connect with the patient, and help understand how we might be able to help.
Mm-hmm. Yeah, I really like that. What I would add to that is, how do you perceive your treatment? I think that would be really interesting too, because so often I see that correlates the perception of their therapeutic, their chemotherapy or whatever it is in front of them, really changes their dynamic of how they interact.
Right, and there's so much in the alternative literature. What is their phrase? Burning, cutting, and poisoning.
Oh, right. Oh my goodness,
and
really.
A lot of these patients are seeing that.
It does highlight that kind of stigma,
right,
if you will, of some of our therapeutics and how that can change the patient's perception of their therapy and how they receive it. Right. So I think that's so important to tease that apart too. What is their relationship with their chemotherapy, their treatment, and their oncologist, their primary oncologist, I think is important.
And here there's also that challenge about killing the cancer.
Mm-hmm. Right, cancer is a battle, right?
Right.
Yeah.
There's a war going on, and some people that's good for the way that they think. And then some people want to love the healing of their body. And again, there's this intuitive process that goes on so you could connect with how this patient's going to do best.
Absolutely. I think that's so important.
So her answer was the way she perceives it is as bad luck.
Mm-hmm.
She is often tired. There are times I do not want to do anything, not even with my family. Next question is personal life history, present relationships, support systems, and resiliency. So here we delve into social connections, support systems, and more opportunity to connect with the patient. This patient's answer, I have no known history of cancer in my family. I would be the first, although I do not know my father, so I do not know his family history. I am married, going on 23 years. My husband, children, and extended family are my support.
Yeah, I like to spend a fair amount of time on this topic because in integrative medicine, we need to know who our team members are, right? So it's us as a provider, the patient in front of us, but it's also their extended network, right? And so it's their family members, their best friends, their pets, their church community, their hobbies. And so it's really this whole network that we really need to understand and engage, and really to understand how supported are they, or do they even have a support system? And so I really, and then they also feel heard and connected with when you really spend a fair amount of time in this domain.
That's right. Next question, home environment. Her answer was safe and secure. I live with my husband and children. Next question, occupation and work environments. So these two prior questions refer to potential toxins, and we're very concerned about reducing toxins, again, from an epigenetic standpoint.
Yeah.
There is an environmental handout that you'll be able to see as a PowerPoint slide. There's also the site, the Environmental Working Group, ewg.org. You can look up, and patients can look up cleaning products, personal items. A famous website to look at by them is the Dirty Dozen Pesticides Found in Fruits and Vegetables. And interestingly, they changed. A few years ago, apples were the top one. This last year, now strawberries are the most contaminated. And still, I teach patients if they can't find organic produce, so they're going to have pesticides, there's a reasonable chemical trick to take 2 teaspoons of baking soda in a quart of water and soak the fruit or vegetables for 20 minutes, and it markedly reduces many of the pesticides. And there are lots of studies that you can look at. Also regarding seafood, there's the Monterey Bay Aquarium Seafood Watch, and that helps with levels of mercury. Her answer, currently a medical assistant. My coworkers are wonderful and understanding of me having so many appointments.
So her answer, she didn't really address her toxins there, so I guess we assume that there's really no toxins in her environment. I did want to comment on the Dirty Dozen, the Clean 15, and your technique there with cleaning the potentially non-organic fruits and vegetables, that it makes it more attainable, right? You can't always buy organic, particularly if you're on a budget, and I think that's one of the challenges that we really have in integrative medicine as a whole, is that to do everything the right way can be prohibitively expensive. Right? Mm-hmm. So we need to really meet the patient where they are. and what are their resources. And if they don't have the resources to eat all organic, what are the tricks, right, to diminish the pesticide exposure? And those are a good couple that are shared there.
Isn't it EWG that also has a site on how to buy clean food on a budget?
I believe you're right.
Yeah,
Yes.
that- And that's useful in addition. Clean, healthy, natural food. Next question, daily average physical activity. You know, this is huge in integrative medicine. There are so many articles on physical activity. The general initial goal is 30 minutes moderate activity 5 days a week. Aerobic, Tai Chi, Qigong, yoga, there are so many options. Her answer, now I am not active. Prior to this diagnosis, I would go to the gym 5 days a week to cycling class and boot camp.
Boy, that's a pattern we see often, isn't it? Yeah. Life changes after a cancer diagnosis, and I think we have to honor that it really, you know, what used to be possible is likely not possible anymore. And so it's really about finding with the patient in front of you, what are some goals that are A, exciting, and B, doable, right? So what are reasonable goals? And then I think it's important to go back and say, well, what did you used to like, right? What really, and who were your advocates for that activity? Did you have a buddy in the past? Pull that buddy back in. But just to highlight as well, what you had said is how important it is for the journey in cancer care to really encourage physical activity cannot be understated or overstated.
Right.
Because, again, all the data, as you mentioned, and I've done a couple of pilot studies in meditative movement where just as little as 10 minutes of yoga in MPN patients actually not only changed their quality of life, but changed markers of inflammation. We actually measured tumor necrosis factor alpha in patients doing yoga and MPN patients. And so, you know, such a small little intervention can really shift not only the patient's experience, but also the biochemistry. And so we really have to educate our patients on the potential benefits of that and then meet them where they are, right? And help them along the way and risk adapt. And you know, if they're ECOG performance status 3, if they're very, you know, debilitated, they can't go and do the, you know, vigorous things perhaps they used to do, but they certainly can do chair yoga, for example, right? So just trying to meet them where they are and change our intervention as their journey changes over time.
That's true. We had an exercise physiology center at our cancer center, and it was really useful to have the exercise physiologist do exactly that, meet the patient where they are. And again, it's individual. There's not a typical patient. And especially when they're going through therapy. And for example, the men that are on Lupron and other gonadotropin releasing hormone antagonists, it affects their ability to do physical exercise.
Absolutely. Yeah, we have to honor that.
Next question is spirituality. What is your source of comfort, inspiration, connection? And this is interesting because you'll notice I don't ask what their religion is.
Yep.
But I would get such snarky comments because I didn't ask what their religion is. So sometimes people really just want to let you know what their religion is to answer spirituality. And then on the other hand, there are people that would say, I'm spiritual and not religious. And all I'm asking for is their source of comfort, inspiration, and connection. But it just seems to be a bit of a button pusher.
It really is. I've discovered that multiple different times. And so now I frame that under the guise, as you did, in connection. How do you connect? How do you connect with something outside of yourself? But I think this is where the intake form really helps, because you know where their starting point is, right? And how to really frame that conversation when you go into the encounter.
Right. And to me, the reason for this is an opportunity to talk about their spiritual connection, to hear if there are existential concerns, hope, hopelessness. It's real important for us to pick up on that. Where we were in Colorado, there was a contemplative prayer center, because some people would say, well, I'm Christian or I'm Catholic, but I don't get what I need. And then I would talk to them about the concept of that contemplative prayer. And it would be useful. Her answer was, I attend a great church and have amazing support spiritually. So
That's great.
that's good for her.
I try to encourage patients to engage in that domain every day somehow. Yeah, and so I think another maybe potential addition to an intake form is, how often do you engage with your community, with your spirituality? You know, how big of a part is it in your life? I think is really key.
Yeah. Next question was, what causes you stress and how often does it happen? When do you feel when you are stressed, and what type of symptoms do you have when you are stressed? I'll talk about tools after the next question. Her answer was, my life situation. I was diagnosed with breast cancer. I'm a full-time student for nursing with a full-time job. Daily, I have a battle with stress. I feel angry to the point that I do not want to talk to anyone.
Oh my. So
Sometimes
we have some work there.
Sometimes it really comes out.
It's true.
So I'm taking notes, you know.
Yeah.
What do you do for relaxation and how often? And now I'll point out some tools that I often talk to patients about. For relaxation, there are breathing techniques. We've seen the 4-7-8 breathing. I also will sometimes actually take a minute and do square breathing with the patient, or triangle breathing. I ask them what do they prefer, square or triangle. And then we do it for a minute or two, and it's amazing what happens to them. There are breathing apps, Breathe to Relax, which they can do. There's mindfulness-based stress reduction. There's Insight Timer and other meditation apps. There's forest bathing, or here we do desert bathing. What's interesting is we talked about exercise above. Interestingly, there are some people, they exercise and it's how they relax. They get into a zone.
Absolutely.
Are you one of those people?
I am.
I kind of thought you might be.
I'm completely biased when it comes to Tai Chi. I'm an instructor, I do research, I write grants, so definitely Tai Chi, but also yoga and hot yoga. There's something with that, the heat in the yoga that's special.
Yeah, and there's some people when they run, especially long distance, when they get to a certain distance, they go into this zone and, you know, their heart rate variability increases.
Absolutely.
So it's interesting. And like Dr. Gowan was just mentioning, is yoga a relaxation or is it an exercise? Is Tai Chi a relaxation or an exercise? Qigong, relaxation or exercise?
Or is it meditation?
And the
Right?
answer is yes.
It's all of the above.
Sometimes they're not separate.
Yeah. What I like to go into when we're talking about stress reduction too is with patients, they need to realize that stress really manifests. We see this in multiple animal models and even in some human models, that stress manifests, and obviously in some of the neurotransmitters that we see, right? Cortisol, norepinephrine, epinephrine. But what happens to that tumor microenvironment in that stressed animal or human is quite profound, right? We see that in stressed animals that there's more metastasis going on, that tumor cells are actually moving at a faster rate. that there's more blood vessels that are growing, that VEGF is upregulated. And we see that the immune system, on contrary, is really being hampered, right? The natural killer cell are actually migrating at a slower rate, and they have a lower tumor kill. So, you know, it's translating into science, really robust science, that stress manifests into a poorer microenvironment and a higher likelihood of metastasis, advanced disease, and poor outcome. And so I think when they hear that, they're like, really? Oh my gosh, I had no idea. And they have to start taking some accountability that stress management is really part of their therapeutic regimen, that they have to become aware, right? Take some stock, take some inventory throughout the day. And then, as you mentioned, to have really a set of tools, strategies to intervene when that stress is really manifested and you're aware of it.
So true, absolutely. So her answer, what she does for relaxation, nothing. So yes, she's stressed and she doesn't do anything about it. So
What an opportunity
right.
for change.
The next question, describe what it looks like when you are happiest. And for me, this is another chance to learn areas to connect with the patient, see in a different sense what her goals are. Her answer, there is a peace in the home and I smile more.
I wonder, do you follow up too, and what are the hobbies, what are the joy activities from that intake? Is that something that you really focus on? I love that part, but
yeah. That's the elaboration part.
Yeah.
You know, it's hard choosing the words at the beginning to just like, you know, you want to be brief and, but yeah, I think hobbies are real important and I always do ask that.
So I will say my experience too is teaching fellows in the clinic that it's been that joy pillar. I talk about them in pillars, mind, body, spirit, which is also connection, and joy is the final pillar. And that has shifted the fellows. And so I really think that, you know, joy is something that is under discussed and under practiced as an intervention.
Mm-hmm. Yeah, it's so important. All right, next question. Describe your sleep. And here we have integrative sleep handouts. We have dysfunctional thoughts regarding sleep. There's a lot of really misinformation about sleep that patients have. Her answer, I fall asleep. I sleep horribly because I wake up 4 hours later. I don't know why. Then I think about everything and eventually I fall back to sleep.
Sleep is a challenging one.
Yeah.
It really is.
Yeah.
And so pervasive within the cancer care population. You know, I think it's a rarity to find a patient that's sleeping well.
Right.
Especially in my practice, I'm a myeloma focus, so everyone's on steroids. But
Oh, right. Yeah, that'll do it.
yeah, I think it's hard. And so we talk about sleep hygiene, and you're probably going to go into that. But I really think it's a challenge.
It is. Although when I bring up the dysfunctional thoughts to sleeping, and it's interesting because the majority of patients, they score 100% that they 8 out of 8 have dysfunctional thoughts.
Wow.
So sometimes, for example, this one, she falls asleep, but she wakes up 4 hours later. Well, technically that's normal. We technically sleep in 3 to 4 hour segments. We sleep deeply, and then when we're young, we fall back asleep and don't even realize that we kind of woke up, but not completely, and then we go back. When we get older, we often get up and go to the bathroom. Now, she's getting up after those 4 hours, and often when I talk with patients and I say, you know, that's really normal, it's just a little bit, there's an increased perception and an increased sensitivity because everything in your life has increased sensitivity right now.
Yeah.
After getting a diagnosis like that, you talk about those hormones, you know.
Exactly.
So sometimes just that reassurance that I'm actually okay is important. Then a question, any high-risk behaviors, listing past and present, helps me get to know the patient better. She had none. And then a very big one, what is your diet and nutrition like? Please list typical daily nutritional intake, including meals, mealtime, and snacks if applicable. And here we have the opportunity to talk about the anti-inflammatory diet, to bring out the biochemistry of phytochemicals and talk to the patient about what is available, to talk about cancer-specific diets. There's, for example, the information about prolonged nightly fasting for breast cancer. For people that just have to buy canned foods or prepared foods, I show them that there are better choices than others. So
Absolutely.
there's a website, Amy's Food, and you could go to that. And when you read the ingredients, they're all ingredients that you understand as being food. You don't see any chemicals. For those patients that have to have bacon, even though we tell them so much that they need to avoid processed meats, I show them the Applegate website and how to choose uncured bacon, and if you can, move towards the uncured turkey bacon. So again, you meet the patient where they are, and you make whatever move you can.
Yeah. Yeah, I love that this intake really asks them to kind of give you a food diary. I often spend a lot of time in clinic really going through, you know, what does a typical breakfast and lunch and dinner look like for you? And what really comes out from that is not only their preferences and quantity, but kind of their cultural influences, right? And so that you can kind of start talking about not only the anti-inflammatory diet as an umbrella recommendation, but also what are some tweaks that they can do that's going to kind of shift it towards their own preferences, their own cultural kind of preferences, which I think can be a challenge, particularly in the Hispanic population, right? There's so many, you know, tortillas and beans and rice, and so it's hard to kind of make that shift, but it's important to know if that's really their staple, where you're starting from, so you can kind of make that shift in a really mindful way. I love the phytonutrients, and we're drinking our green tea here with our EGCG, right? And so it's fun to bring out little tips and pearls about the food, and I love to talk about Asian mushrooms and potential immune benefit and how to incorporate that in their recipes, you know, saute your shiitakes, maitakes. So I think it helps to have a passion for cooking here in this nutritional category, and to try to inspire your patients on recipes that they can actually do.
And so in Colorado, I was also close to Wyoming, so we would have, you know, some hunters, and so we had a lot of meat eaters, and that was a challenge. But then there were wives that would make these pies out of Crisco, you know, totally hydrogenated vegetable oil.
Right.
So I mean, it's as toxic can be, let alone all the sugar in the pie. Those are real challenges.
Yeah, they really are. Yeah, I had a patient in clinic last week that said that she lived off Chick-fil-A and ice cream sandwiches.
Yeah. So her answer was, I know that I am not eating enough. I will eat breakfast, 1 egg, coffee, and toast. Then I won't eat till 6 p.m. due to lack of appetite. I will eat a couple of bites of chicken, potatoes, and a soda. I do not eat snacks. So we're definitely going to be talking about nutrition with her.
Well, I think her answer really highlights another one of the challenges in cancer care is like not all nutritional recommendations are appropriate for every patient, right? Some are cachectic, losing weight, not eating at all. And so to spend a lot of time on anti-inflammatory diet and recipes, it's really not time well spent
Right.
for those patients. So I think the time well spent is what can you eat right now?
Right.
And how do we modify that into the most phytonutrient dense recipe for you possible?
Right. Yeah. Are there any berries that you like?
Yes, give me a berry.
Next question, do you have any experience with complementary and integrative medicine? And there are many reasons for this question. One is that there are patients that will come, and this is where they will let me know, as a matter of fact, I've gone down to Mexico and I've gone to a clinic there, and I'm thinking of getting my cancer care there. And it took until this question for that to come out. Others, sometimes they'll say it at the very beginning. There's the Gerson protocol and Gonzalez protocol. And I used to see, unfortunately, a number of patients that would come back. They would first be seen with curable disease.
Mm-hmm.
They'd go down there and spend a lot of money, and they'd come back with incurable disease.
I know. I've also seen that a fair amount.
It's so sad.
It is.
And then some of them come back, and their skin is orange from whatever they were taking too much. I don't know if it's carrots or it's really sad.
And I think it's important not only to figure out, what are the potential harmful things that they're doing, but also identify were there things that they perhaps did in the past, such as acupuncture, for example, that was beneficial for a shoulder injury. And, re-invite them to go back to that modality that was previously helpful, that they previously really felt beneficial. And so that really probably will enhance their likelihood of responding to it now.
Yes, absolutely. On the other hand, there are the people, just like you were saying, there are people that, well, yeah, I'm a Reiki practitioner, and I've done Reiki with my dog. And so if they're open to these modalities, then they may be open to energy medicine modalities such as healing touch or external qigong. And when they are, I've had a lot of very good response, particularly with healing touch.
Absolutely.
Yeah.
Thank you.
Namaste.
Namaste.
After reviewing this patient's intake form, we embark in the consultation in the appropriate direction. In this case, diet, stress reduction, exercise, fatigue and sleep, toxin reduction will be points that we need to hit. For the sake of time, we won't dive into those any further today. You will have the opportunity elsewhere in the curriculum. I would, however, like to show one more handout, that being the AICR WCRF recommendations for prevention, which is seen on the American Institute of Cancer Research.org website. And I made additional changes. They're noted in italics. And then I often found this a very useful and grounded synopsis on lifestyle changes that can be relatively easily made by and for the patient. The website is also very good to look things up that the patients ask questions about. The alkaline diet, they have a nice article on that and other things like that. Well, I hope this has been useful and helpful for you. As I mentioned in the introduction, the approach in integrative medicine requires more than taking a diagnosis stage and working through an algorithm. It takes skills of intuition, deep listening, connection, motivational interviewing, amongst others.
Well, thank you so much, Dr. Goodman, for joining this conversation today, for leading this conversation. And I think it's so important. I mean, this really, it sets the stage of how this patient's going to move forward on their integrative journey. And I think the intake really helps us as practitioners to come into that room armed with as much information as possible, and to really tailor it, and getting back to that idea that you brought up at the very beginning, personalize it for that patient in front of you. So thank you so much for joining us, and have a beautiful rest of your day.